If you're over 40 and starting to notice those urgent bathroom trips, a weaker stream, or that nagging feeling that your bladder never fully empties, listen closely. Because what you think is just aging might actually be the early signs of something entirely preventable. What if I told you there's an overlooked vitamin, not a drug, that's been scientifically shown to shrink your prostate, lower inflammation, and even improve your sex life? And what if the real reason your medications and supplements haven't worked is because the problem isn't just in your prostate, it's in your pelvic floor? Shocking, right? In today's video, I'm going to walk you through the latest medical research, breakthrough natural therapies, and the one daily routine that could finally solve the frustrations of frequent urination, poor sleep, and even chronic pelvic pain, all without surgery or side effect heavy medication. So if you're tired of feeling like you're being held hostage by your bladder, don't click away, because what you'll learn in the next few minutes could completely change how you manage your prostate health for life. Before I create the next series of videos, I want to hear directly from you. Tell me what you need help with. Are you facing challenges with your erections, struggling to maintain them, or noticing a drop in your sex drive or testosterone? Or maybe you have concerns about size or overall performance. Whatever it is, this channel exists to support your health, your confidence, and your progress. Your input truly matters. Comment your age, your weight, your country, and the specific topic you want me to cover. Your voice will shape the upcoming content because your well-being is and will always be my priority. I'm Dr. Fiona, and what you learn in this video, your doctor probably never told you. Let's get started. As most of you all knows already that as men age, one of the most common and frustrating health challenges they face is benign prostatic hyperplasia, or BPH, a non-cancerous enlargement of the prostate gland. While it may sound benign in name, the symptoms can deeply affect daily quality of life. The prostate surrounds the urethra, the narrow channel responsible for carrying urine from the bladder. As the prostate grows, it can begin to compress this passageway. This leads to a wide range of urinary symptoms: frequent urination, especially at night, difficulty initiating or maintaining a steady stream, a sensation of incomplete bladder emptying, and even urinary retention. Understandably, these symptoms can become both physically uncomfortable and emotionally disruptive. At the root of this condition lies a hormonal cascade deeply intertwined with the male endocrine system. As men, our primary sex hormone is testosterone. It governs many aspects of our physiology, from the deepening of the voice during puberty to muscle mass development, libido, and even facial hair growth. However, testosterone doesn't act alone. With age, a significant portion of testosterone is enzymatically converted into a more potent androgen, dihydrotestosterone, DHT. This conversion is driven by the enzyme 5-alpha reductase. DHT has many functions in the body, but when it accumulates excessively, it's been strongly linked to the overgrowth of prostate tissue. In fact, numerous studies in urology confirm its central role in the pathogenesis of BPH. Interestingly, this same pathway is also involved in male pattern baldness, as DHT contributes to the miniaturization of hair follicles over time. This is why many pharmaceutical approaches to BPH, such as finasteride and dutasteride, work by inhibiting 5-alpha reductase. By slowing the conversion of testosterone to DHT, these medications can help reduce the size of an enlarged prostate and mitigate symptoms. However, pharmacologic therapy doesn't work for everyone, and some patients report unwanted side effects. That's where integrative approaches can offer additional support. Now, let's talk about vitamin D, a fat-soluble vitamin that, until recently, wasn't widely recognized for its role in urological health. But emerging research in the last decade is reshaping how we think about vitamin D, not just for immunity and bone health, but also for its impact on inflammation and hormone regulation at the cellular level, particularly in the prostate. Multiple studies, including one published in the International Urology and Nephrology Journal, have observed that men with lower levels of vitamin D tend to have larger prostate volumes, more severe urinary symptoms, and a greater likelihood of developing BPH. In fact, over 50% of men over 50 are affected by BPH, rising up to 90% of men by the age of 80. And a significant proportion of them are also vitamin D deficient. Clinical trials have demonstrated that daily supplementation with vitamin D3 at doses of 4,000 to 6,000 IU can help reduce prostate volume and improve urinary outcomes. It's postulated that vitamin D modulates prostate cell growth and reduces local inflammation by influencing key molecular pathways, including the nuclear vitamin D receptor, which is highly expressed in prostate tissue. In patients experiencing prostate-related symptoms, we often also see overlapping signs of what's now referred to as Chronic Pelvic Pain Syndrome, CPPS, a complex condition that presents similarly to BPH, but often has a neuromuscular or musculoskeletal origin rather than being purely urological. CPPS can arise from prolonged sitting, poor pelvic posture, obesity, a weak core, or even an injury to the pelvic floor muscles. Over time, these imbalances can create trigger points, tight bands of muscle fiber, that refer discomfort to the rectum, prostate, or perineal area. And here's the key point. This muscular dysfunction can cause all the symptoms of BPH without significant enlargement of the prostate itself. Unfortunately, many standard treatment protocols fail to recognize CPPS. Patients are often misdiagnosed with prostatitis and placed on antibiotics or anti-inflammatory agents, even when there's no evidence of infection. This is not only ineffective, but it can also delay proper recovery. To address this, focus must be placed on pelvic floor rehabilitation. Targeted stretches and exercises to release tension in the deeper pelvic musculature have shown remarkable benefits, in some cases reversing years of discomfort attributed to prostate problems. While every case is individual, commonly beneficial stretches include pelvic tilts, deep squat holds, butterfly or frog stretches, and diaphragmatic breathing techniques. These exercises help reset muscular tone in the pelvic floor, improve circulation, and allow the body to regain balance between strength and flexibility. Physical therapists trained in male pelvic health can provide personalized protocols, and for many men, this approach has been truly transformative. In addition to vitamin D and pelvic-centric therapy, there are several natural compounds that support male urologic health. Among the most researched are beta-sitosterol, saw palmetto, Pygeum africanum, ryegrass pollen extract, and lupin extract, which specifically may suppress the conversion of testosterone to DHT. And then there's zinc, a mineral that plays a crucial role in cellular metabolism, immune function, and hormonal health. Interestingly, the prostate stores more zinc than virtually any other soft tissue in the male body. Zinc has antioxidant effects and may serve as a natural 5-alpha reductase inhibitor, reducing DHT burden without side effects. Of course, supplements alone aren't a fix-all. Lifestyle behavior remains a leading determinant of prostate health. A high-sugar, processed diet, sedentary habits, prolonged sitting, especially in cyclists using narrow seats, can increase inflammation and exacerbate symptoms. Incorporating regular physical activity, avoiding inflammatory foods, ensuring deep restorative sleep, and reducing stress all play essential roles in maintaining a healthy genitourinary system. Let me address one of the most frequent questions I receive. How much vitamin D should you take? The commonly recommended daily allowance, about 600 to 800 IU, is generally insufficient for therapeutic purposes. As a clinician, I typically advise starting at 2,000 IU per day, taken with a meal that includes fat, since absorption increases significantly with dietary lipids. However, vitamin D metabolism is highly individual. Factors such as age, body fat percentage, gut health, genetics, and sun exposure all play a role. That's why I strongly recommend having your 25-hydroxy vitamin D blood levels tested, ideally after 2 to 3 months of supplementation. For male patients targeting hormonal balance, immune function, and prostate health, I aim for a range between 50 to 70 mg/ml, a range supported by most functional medicine guidelines. It's worth noting that besides magnesium, vitamin D deficiency continues to be one of the most common micronutrient imbalances seen in clinical practice. This deficiency has been linked not only to prostate dysfunction, but also to increased risk of respiratory infections, cardiovascular disease, and even depressive symptoms. Optimizing this single nutrient can make a significant difference in your overall wellness. In summary, if you're experiencing urinary difficulties, don't assume the problem starts and ends with an enlarged prostate. Consider your hormone levels, your posture, your pelvic floor health, and certainly your vitamin D status. With the right knowledge, testing, and interventions, both conventional and natural, it is absolutely possible to regain control, restore comfort, and dramatically improve your quality of life. I'm Dr. Fiona, and I truly hope this information empowers you to take your health into your own hands. Stay consistent, stay informed, and above all, never underestimate the power of a few small changes done consistently. And if this message resonated with you, don't keep it to yourself. Share it with someone who might need it today. Take care and stay healthy.